Good to see you again, Shelley.
Hi, Jason.
So I know you've done lots of research, and your pamphlets that you've published have made it to Governor Holcomb's office.
Yes, thanks to April Weaver. Shout out to my girl over there in Grant County, April Weaver.
And you have a weight chart for CBD. And when I was in the Indiana Senate hearings and I was testifying, they kept directing and asking me, say, well, it doesn't have a standard of treatment for CBD. And when I worked in the ICU, the doctors used to write us orders that said titrate to effect, which just means use the drug and find out how and where the drug works the best for this patient to reach these criteria.
Therapeutic range.
That's right.
Yes.
So some people need a little more, some people need a little less. It's either because of your age, your sex, your ethnicity, genetics. There was so many factors that a standard dose
Yes.
in the critical care setting does not work. Now,
Not for everybody. Everybody's is different, like you said. Everybody's different. Their bodies are different
and
and conditions.
so let's talk about your pamphlets and your weight chart.
Okay, well, 4 years ago when we started teaching CBD, we had nothing to follow. So I was working with a doctor. Remember, we had this in practice in a doctor's office. So we started looking at people that have been using CBD, because that only makes sense. That's what we call anecdotal evidence. So of course we look at people who've been using it. We start looking at companies at milligrams that they design, and we start figuring out how to figure the milligrams per dropper. So then there's different types of CBD oil. So you have different plant profiles of different types that are what's in the bottles. So we tried several different types, and we had a good group of people in our little clinical research in my office, basically. Me, who has 3 crippling diseases, my personal medical assistant with migraine headaches. We have family members that are bipolar, schizophrenic, blah, blah, blah. Our list goes on and on and on. So when we first got it, we did not know how to use CBD oil, and as like any other medication, we believe it is weight-based. So we started a program off of clinical research, like trial research that had been done on patients to figure what they'd use milligram-wise to know how to use it, along with anecdotal, which is all people had been using it for years, to figure milligrams per dose. So yes, we set up a system to figure milligrams per dropper and a starting point according to weight and according to severity for patients. We have been pretty accurate with our weight chart. Sometimes we can get things under control the first time. I may have a patient who hasn't written their name in 16 years because of tremors, and their wife might call me on the phone and be like, is this supposed to be happening? So sometimes we are on with it, but the truth of the matter is we are designed with an endocannabinoid system with receptors for the plants. This is medicine. There's no reason, when I ask leading research scientists in the world, they all believe this will be a simple blood draw, just like anything else that I would regenerate or give you supplements for in the hospital. Potassiums, magnesiums, anything. We just aren't there yet, so we're still guesstimating a little bit. But doctor would also tell you at the end of interviews that we have little to no side effects with these medications, so we felt pretty comfortable learning to use them.
Well, thank you, Shelley, for going over the weight-based treatment that you and the doctor had developed. And it's just such a blessing to everybody who comes across your doorstep at the shop. Well,
Thank you.
We'll see you later, and have a great day, Shelley.
Thank you.